What's up, guys? How are you doing? So today we are continuing our exploration of topic of heartburn, acid reflux, and GERD. And the next post that we researched, because we were getting a lot of queries about baking soda for heartburn, right? So we used AI, did some research, pulled up some things, and have compiled a blog post, which the link of which I'll share in the description here. And let's do a reading of the same, right? So let's get straight to the point. Heartburn can strike when you least expect it, after a hearty meal, a late night snack, or even just bending over. The familiar burning sensation behind the breastbone is not only uncomfortable but often disrupts daily life. If you are looking for a simple, natural remedy, look no further than your kitchen cabinet. Baking soda, a humble household staple, has been used for generations to relieve heartburn and acid reflux. Let's get on with it. But how exactly does it work? Is it safe? How do you use it effectively without risking side effects? That's what we want to talk about. In this quick guide, we will deep dive into how baking soda relieves acid reflux, the science behind it, best practices for safe use, risk to watch for, and how it compares to other remedies. So you can make an informed, confident choice for your digestive health, right? So first, let's understand what is heartburn and acid reflux. Heartburn is a symptom of acid reflux, a condition where stomach acid backs up in the esophagus. This happens when the lower esophageal sphincter, I always fail to pronounce it, LES, a ring of muscle that acts as a valve between your esophagus and stomach, right? It does not close properly and or relaxes at the wrong time, right? So the acid comes back up and, it creates trouble. When acid escapes the stomach, it irritates the sensitive lining of esophagus, causing that signature burning sensation, often accompanied by a sour taste in the mouth, bloating, or even coughing for some. For many, acid reflux is occasional and triggered by certain foods, large meals, stress, or lying down too soon after eating. But for others, it's more frequent and becomes GERD, gastroesophageal reflux disease, a chronic, potentially damaging condition. Well, baking soda is not recommended for GERD patients, right? Remember that. It's very important to note. And this is not medical advice. You can do your own research. I'm not an expert, and this is just an internet, right? Research that we have done. How baking soda works to relieve heartburn. Baking soda, or sodium bicarbonate, is an alkaline compound that counteracts acid. When ingested, it neutralizes hydrochloric acid in the stomach, helping to quickly reduce acidity and relieve discomfort. Here is what happens when the baking soda hits your tummy. Sodium bicarbonate, which is baking soda, plus hydrochloric acid, which is the acid in your stomach. When it reacts together, you get salt, water, and carbon dioxide, right? So that neutralizes the HCl. This reaction not only decreases stomach acidity but produces carbon dioxide gas, which may cause burping, often a sign the mixture is doing its job. Rapid relief. One of the biggest advantages of baking soda is its speed. Unlike medications that may take 30 to 60 minutes to work, baking soda typically relieves heartburn within minutes. That's why it remains a go-to home remedy, especially in urgent situations. All right. So how to use baking soda for heartburn release is very simple. Half teaspoon of baking soda, 4 to 6 ounces of cool water. Dissolve the baking soda completely in the water. Drink slowly, sip, don't gulp. Wait for 15 to 30 minutes for relief. Tips for effective use. Take it at least 1 or 2 hours after meals to avoid disrupting digestion. Stay upright for at least 30 minutes after taking the solution. Use only as an occasional remedy, not as a daily treatment. I mean, if you use it very often, it essentially might become ineffective, right? That's what it says, I think. Dosing guidelines. Adults can take half teaspoon every 2 hours, but do not exceed 7 doses, 3.5 teaspoons in 24 hours. If over 60-year-old, limit to 3 doses per day. Excessive uses can cause serious health risks. More on that below. And guys, please consult some other sources and doctors before you make any of these, choices. Baking soda versus baking powder, know the difference. Though their names are similar, baking soda and baking powder are not interchangeable when it comes to treating heartburn. I mean, even I was confused between the two. I never knew. But then here it goes. Baking soda contains only sodium bicarbonate, neutralizes stomach acid effectively, safe for short-term internal use. Baking powder is a mix of sodium bicarbonate and acidic components intended for baking, not consumption on its own. Can worsen heartburn due to added acids, right? So don't use baking powder. Many people mistakenly reach for baking powder only to find their symptoms worsen. Always verify the label before using any white water from the pantry, right? So that's what it says. Sodium bicarbonate in over-the-counter antacids. Baking soda isn't just a home remedy, it's the active ingredient in several commercial antacids. Products like Alka-Seltzer, Zegerit, that is omeprazole plus sodium bicarbonate, and there are some other effervescent tablets as well. I think Tums is one of them, I think so. Use sodium bicarbonate to quickly lower stomach acid. However, commercial antacids are formulated for safety, taste, and consistency, and may include other agents to buffer the stomach lining or extend relief. Still, baking soda's pure form can be just as effective if used properly. The baking soda burp test for low stomach acid. A growing number of people believe they suffer from low stomach acid rather than too much. One popular DIY diagnostic tool is the baking soda burp test, right? So if you think that you have lower stomach acid, then this is how you can test it. How to do it? Mix 1/4 teaspoon of baking soda in 4 ounces of cold water. Drink it on an empty stomach first thing in the morning, and time how long it takes for you to burp. If you don't burp within 3 to 5 minutes, it might indicate low acid levels. This is when you test, right? However, this test is not medically validated. Many factors like carbonation tolerance, digestion speed, or the presence of food can skew results. If you suspect chronic digestive issues, consult a doctor for a proper testing, such as Heidelberg pH test or something, right? So risk, side effects, and when to avoid baking soda. Though baking soda offers fast relief, it's not without risks, especially with frequent use or high doses. Possible side effects: bloating and gas due to carbon dioxide buildup, nausea and stomach cramps, increased thirst, elevated blood pressure from high sodium content, kidney strain, serious risks of overuse, metabolic alkalosis, a dangerous condition where the body becomes too alkaline, electrolyte imbalances, water retention and swelling, heart rhythm disturbances. I mean, these are all things which can happen if you are overusing the baking soda, right? Who should avoid baking soda for heartburn? People with high blood pressure, those with kidney disease or heart failure, anyone on a low sodium diet, pregnant women unless approved by a doctor, children under 6-year-old. Even occasional users should watch for recurring symptoms. Chronic acid reflux should never be self-managed with baking soda alone. I think here we're talking about curd, right? So if you have that kind of situation, it's better to consult a doctor. That's what it says. Natural alternatives and lifestyle remedies. If you are looking for a gentler, more sustainable way to manage acid reflux, consider these alternatives. Diet and lifestyle tips: eat smaller meals more frequently, avoid trigger foods, spicy dishes, citrus, tomatoes, garlic, onions, chocolate, caffeine. I mean, these are the things that can trigger some, heartburn and acid refluxes. Stay upright for 2 to 3 hours after meals. maintain a healthy weight, elevate the head of your bed by 6 to 8 inches, chewing gum to stimulate saliva and neutralize acid. So I think the saliva helps, right? Herbal and natural remedies. The other herbal and natural remedies that AI recommends, which we found during the research: ginger tea soothes the digestive tract, aloe vera juice calms esophageal inflammation, licorice root supports mucosal lining, slippery elm forms a protective coating in the esophagus, bicarbonate-rich mineral water backed by recent studies for gentle relief. When to seek medical advice: if you are experiencing heartburn more than twice a week or symptoms like chronic cough, hoarseness, difficulty in swallowing, sensation of a lump in the throat, chest pain, especially if severe or radiating, then you may be dealing with GERD, you know, ulcers or other condition that require medical evaluation. Untreated GERD can lead to complications such as esophagitis. I mean, that's a condition you can read here. Barrett's esophagus or even esophageal cancer. Nah. Don't let convenience replace care. Baking soda can help, but it's not a cure. Final thoughts: is baking soda a good remedy for heartburn? Well, baking soda is one of the most accessible and effective short-term solutions for occasional heartburn. It acts quickly, it is inexpensive, and when used properly is generally safe for healthy adults. But like any remedy, it comes with caveats. Its high sodium content and potential side effects mean it should be used sparingly and responsibly. Most importantly, if you are experiencing frequent severe symptoms, the underlying issues must be addressed. Use it occasionally, avoid frequent or high doses, always consult a doctor if symptoms persist. And then we have a series of frequently asked questions which you can read. I'm going to leave the link to the blog post in the description here. And I think the crux is that if it's an occasional use, if it's once in a while kind of a situation that we're facing, baking soda works like a charm. That's what our research says. However, if it's something more regular, then you might want to consider a more serious medical advice. And again, I'm not a medical expert, or it's important to do your own research before following anything that we say, right? So, toodles for now. Follow, subscribe, like, and for more informative information about health and nutrition. Yeah. Cheers, guys.